My name is Miss Anesu Chinguwa. I am designated at Ingutsheni Central Hospital as a Health Promotions Officer in Bulawayo. I conduct health trainings and workshops. I also conduct health education sessions, and I also conduct community mobilizations and community engagement.
Anesu is a young lady who is reliable and dependable. That's how she displays her integrity in her work and in the community.
When it came to tertiary education, I had to look into my calling. What is it that I wanted to do in the long run? Something that I could take up for the rest of my life. And I decided to be in this field for health promotion or public health, where I deal with the community. I have got a calling to engage with people health-wise because I want to enable people to make the healthier choices, the easier choices.
She's someone who is always seeking to do what is right, particularly for our target group, which is our mental health patients and their families and everyone who may be affected by mental health issues.
Anesu doesn't promote health around the local community of Ingutsheni Hospital only. Her motto is use source health first and use source wealth with a health body.
I've seen some things that I didn't know that she actually does, maybe reported even on publications. For example, in the newspaper, you find she's started some campaigns where she was even reaching out to hard-to-reach groups like our informal gold miners and things like that, basically talking about issues ranging from substance abuse and things like that and other things that they struggle with. So all of on her own initiative. I mean, I really don't think she's getting anything for that, but it's just the passion that she puts behind her work and wanting to help the community.
She has been to the community of mining area 3 times, trying to teach those people on safe sex, drug misuse and abuse, using her own transport.
The area of being able to prevent diseases, to prolong life, the area of being able to have your health within your hands. That area alone, for me, I think it's a motivational factor, because there is no individual that is unhealthy that can be fit to stand and be productive.
I always tell her, continue with your calling. You didn't become a health promotion officer because there was nothing for you to practice.
It means a lot, because it gives me that motivation to keep on doing what I've been doing. It's not just about the wages that I get at the end of the day. It's about them recognizing the efforts that I put for us to move as one community, as one body, as one healthy body together. So when they recognize me as an integrity icon, it gives me that drive to keep on doing what I've been doing with even more encouragement, because it's not easy. Even myself, I have shortfalls, but when I have someone backing me up, it gives me that drive to continue moving.
So I'm pretty sure that whatever impact that she's having, whether within or without, is actually spreading right through to all the corners of our country.
One of the days when I was conducting health education in our outpatient department, I came across a patient who was deaf and dumb. So now this patient needed help, but there was no one to actually administer help to this patient because no one could communicate. Even myself, I could not communicate with that patient. That gave me homework. I came back, I sat down, and I had to look for services that provide sign language lessons. I would like to say, let's continue working hard. Hard work pays. Let's continue being trustworthy. Despite the conditions that we are working in, it pays off to do things the right way. Because we are one body by the end of the day. We are one Zimbabwe. We want the best for our nation. So let's continue pushing. Let's continue working hard in our different walks of lives. Let's continue doing the best that we can.